You finish peeing, you zip up, and suddenly, there's a little more urine dribbling out. It's awkward, uncomfortable, and honestly, one of the most common frustrations men experience. If this happens to you, you're not alone. Many men deal with this issue, and it even has a name: post-void dribble. Post-void dribble simply means a small amount of urine leaks out right after you finish urinating. Studies show it can affect anywhere from 5% to almost 60% of men, and based on how often it's talked about, it's probably even more common than that. So, why does this happen? There are a few possible reasons. One reason involves a narrowing of the urethra, which is the tube that carries urine from the bladder through the male organ. If this tube becomes partially blocked, perhaps from scarring or a previous injury, urine can get trapped behind the narrow spot. You may push out most of your urine, but some remain stuck behind the obstruction. Then, a few seconds later, once you move or relax, that leftover urine escapes, causing the dribble. Another common cause involves the prostate, a walnut-sized gland that sits just below the bladder and surrounds part of the urethra. Over time, the prostate can grow larger, a condition known as benign prostatic hyperplasia, BPH, which can make it harder for urine to pass through. Men have two valves, or sphincters, that help control urination. One is at the top of the bladder, and another is just below the prostate. When you finish peeing, the upper valve closes, but if some urine is still sitting in the section that passes through the prostate, the lower valve may trap it. When that lower valve relaxes again, the remaining urine dribbles out. This is very common as men age. In fact, prostate enlargement affects up to 70–80% of men over the age of 70. Sometimes, though, post-void dribble has no clear cause. In these cases, doctors suspect muscle weakness in the pelvic floor, the muscles that help push urine through the urethra. As we age, or if we develop certain nerve or muscle conditions, these muscles can weaken. When that happens, they don't squeeze effectively, and a small amount of urine stays behind after you finish. Now let's discuss what you can do about this problem. If your urine stream is weak, split, or you have to strain to get it started, it's worth seeing a urologist. Those can be signs of a urethral narrowing or a prostate problem. You might also notice other symptoms of an enlarged prostate, like feeling the need to go more often, trouble starting or stopping your stream, urgency, or waking up multiple times at night to urinate. The good news is that if these conditions are treated, post-void dribble often improves as well. But if you're otherwise healthy and your only issue is that little dribble, there are a few simple things you can do to help. One easy technique is called bulbar urethral massage. Right after you finish urinating, place your fingertips about an inch behind the scrotum. Press gently upward toward the base of the male organ and move forward while applying light pressure. This helps milk out any urine that might still be sitting in the urethra. You can do this once or twice after you finish. You can also gently shake or squeeze the male organ after urinating to clear out the remaining drops, something many men already do instinctively. Another helpful approach is pelvic floor muscle training, also known as Kegel exercises. These strengthen the muscles that help control urination. The easiest way to identify these muscles is to imagine trying to stop your urine midstream. Those are the same muscles you'll use during the exercises, though you shouldn't practice them while actually peeing. Once you know how to engage them, try this routine. Tighten the muscles for about 5 seconds. Relax for 5 seconds. Repeat 10–15 times, 2 or 3 times a day. Be sure to include the relaxation phase. If you stay tense the whole time, it can cause more problems than it solves. And if you have any pelvic pain, pain during ejaculation, or testicular discomfort, don't start these exercises until you've talked to a urologist or pelvic floor physical therapist. When to get checked. Occasional dribbling after urination is common and usually nothing to worry about, especially as men get older. But if it happens frequently or comes with other symptoms, like burning, blood in the urine, pain, or major changes in flow, it's time to get evaluated. These could be signs of infection, prostate issues, or urethral narrowing, all of which can be treated effectively once diagnosed. In summary, post-void dribble is a common and often harmless issue, but it can still be annoying and embarrassing. The important thing is to understand that it's not your fault, and it doesn't mean anything is seriously wrong. With a few simple techniques, stronger pelvic muscles, and, if necessary, medical treatment, most men can manage it easily. Always remember to take care of yourself because you're worth it.